Hello, and once again, my name is Natasha. Thank you so much for joining the Elsevier Health Live webinar. We'll be starting the session now. I'm joined by my colleague Jade, who will help me monitor the chat and also interact with the audience as we go along. So let's get started. The theme for today's webinar is how do we stay relevant in this challenging and dynamic healthcare environment? Today, we will be discussing how we can help nurses stay relevant as we tackle all the challenges that are posed to us by this healthcare environment that we face today. So in this webinar, we will share a little bit on the challenges that we see in healthcare. We'll talk about the latest technologies and solutions that Elsevier is providing to support nurses for practice, for research, as well as for education. And then we will spotlight on one of our flagship solutions for nursing, which is ClinicalKey for nursing, and discuss how you can use that to improve your practice, teaching, and education. Before we start the session today, I'd like to just go over a few housekeeping rules. So the first one, this webinar is being recorded and a recorded version will be available on demand. So in case you're not able to watch the full session, or if you have colleagues who want to watch the session, feel free to share the recorded version with your colleagues as well. Sorry. During the session, we will have Q&A. We will also have some poll questions. So for the Q&A, you will notice that there's a Q&A box at the bottom of your screen. Feel free to post your questions in the Q&A box. If you do post it in the chat, Jade will help me monitor that, but we would appreciate it if you can post it in the Q&A box at the bottom, mainly because in case we're not able to come to your question, if we're not able to cover your question in today's session, we'll make sure that we respond to you afterwards via email or via a phone call as well. As I mentioned, there will be poll questions in this session. It's very important for us to hear your feedback and your inputs on our observations. So we would love to hear your inputs as well. The polls will pop up on your screen and we would really appreciate it if you could share your opinions. And lastly, we really value your feedback. So it would be great if you could share your feedback at the end of the session. So at the end of the session, we will flash a link and a QR code. You can scan the QR code and give us feedback immediately, or you can also click on the link later when we send you the slides and you can give us feedback at that point. So without further ado, I'm going to start, and I'm actually going to start today's session with a poll question for all of you. Let me just launch it. And we would like to hear from our nursing audience here today on what are the challenges that you face in your day-to-day work. Do you face a challenge in terms of the volume of work? Do you face time constraints? Do you feel like you don't have enough access to credible information? Do you face a challenge because you're playing multiple roles and therefore they eat into the time required for the different roles? Do you feel like you don't have enough time to think or reflect on your practice? Or do you think you don't have enough time to think about career growth, career options? Does that become a challenge for you? I'll give the audience another 30 seconds to respond to the survey, and we will share the results of these polls in this session as well as afterwards with you. But we just want to hear from you on what are the challenges that you face. That will help us also understand how we can customize our solutions to your requirements. So let me share the results of this poll with you. You'll find that the biggest challenge that nurses face today is the increasing amount of work, and that directly impacts the time that you have available. That's very much in line with how we see the healthcare environment changing as well. So if we think about the healthcare environment today, at Elsevier, our mission is to improve patient outcomes. However, we feel that that mission of improving patient outcomes is under a lot of pressure. And one major reason of that pressure is the increasing volume of patients that are entering the healthcare system every day. Every day, we see more and more patients demanding care, requiring care and attention. And it's not just that the volume of the patients is increasing, it's also the complexity of care that they need. In many of our countries, we find that the demographic is aging. At the same time, we also find that new diseases are emerging, and we don't have enough information or research to support these new healthcare paradigms. Therefore, the care that needs to be delivered to the patients these days is far more complex than what it used to be a few years ago. And what this leads to is more questions. These questions can come from the patients, these questions can come from the families, the caregivers, and a lot of questions coming from the healthcare practitioners themselves. Nurses have more questions, clinicians have more questions, young residents have far more questions that they seek answers to on a daily basis. And that just creates an environment of a lot of pressure, a lot of anxiety for the healthcare practitioners, especially for nurses. So when we face so many questions, so many answers to look for, what happens is that we tend to look at multiple sources of answers. That's not the best because A, it takes time to look for those answers. B, those answers may not be presented in a format or in a manner that is actually useful for you. And C, at the same time, because different people are relying on different sources of information, it can lead to different care outcomes. So the way one nurse would care for a patient may differ slightly to another nurse. Slight variation is healthy, but a lot of variation can actually impact patient outcomes. It can impact patient experience in a negative way, and it can also lead to unnecessary costs that we are actually trying to avoid. So when we face this kind of an environment, it's not just today, right? This is going to happen more and more in the future. One big challenge in answering the questions that these nurses face is the evolution of medical knowledge. More and more medical knowledge is being produced. More and more medical knowledge is changing every day. And it's very important for nurses to have access to the latest knowledge so that they can keep abreast with the latest guidelines, with the latest best practices in delivering care for their patients, and also the latest skills in delivering care. So it's very hard to keep up with this evolving medical knowledge. At Elsevier, our goal is to empower healthcare professionals with all the information they need in the manner that they need it, no matter what that topic might be. We try to be entirely agnostic, and we want to be able to answer as many of your questions as we possibly can. So that brings me to my next poll question. Before we go into the solutions that Elsevier could possibly provide, I would like to ask you on what are some of the recent innovations that you have seen in the nursing setting. So anything that you may have come across, explored, or been curious about. For example, nursing decision support tools, platforms to support your continuous learning and skills development, simulation platforms for nursing, 3D visualization tools, or even apps to improve patient experience. And again, the reason why I'm posting this question is mainly because this requirement for nurses can change so much across regions. We've seen in some regions, patient experience is important. In other regions, continuous learning and development is important for the nursing community. So we'd like to hear from our audience here today, from an Asian and a Southeast Asian perspective, on what have you explored in terms of the innovations. I'll give the audience maybe another 30 seconds to respond. All right, let me share the results. And what we gather from our audience today is that there continues to be a lot of interest in platforms to support continuous learning and skills development. So for nurses, this is a very important area of innovation on how we can support nurses in continuous learning. There's also some interest in simulations and some interest in nursing decision support tools. Thank you for sharing that feedback with us. I'm pleased to share that this is actually very much in line with what Elsevier is also trying to do for our nursing professionals. As I mentioned, at Elsevier, our mission is to improve patient outcomes. And the two main areas on how we achieve our mission is by empowering clinicians and patients to make the right decisions, as well as by preparing healthcare professionals, including nurses, for the future. To do this, we actually support nursing professionals with all our solutions that span the entire career journey. So our goal is to provide you with tools that you can start using from day one of your career and well into your practice and research, so that you have access to a holistic platform, a holistic experience throughout your career journey as a nurse in healthcare. So for example, if you think of the nursing career journey, it starts in the student phase. And that's where Elsevier provides ClinicalKey Student Nursing. This is a platform designed to support education for young students, young nurses. So on this platform, you have access to some of the leading nursing textbooks that cover all the major nursing specialties. It also covers midwifery textbooks, but most importantly, it's a highly interactive platform that is meant to engage nursing students through tools and through videos that make learning fun and engaging. So on this platform, you can actually interact with the digital textbooks. You can make notes, you can make highlights, you can share passages, you can even interact, you can even send passages to your colleagues, to other students. And that helps you create this digital environment where all the students can learn together from the best sources of information. So that's how you start as a student. But as you progress through your learning years and into practice, your questions become much, much more complex. And at that point, you need answers which are very diverse presented in diverse formats as well. That's where we provide ClinicalKey for nursing professionals. ClinicalKey for Nursing is Elsevier's flagship nursing decision support tool that gives you access to a variety of content which can be used for point of care. So it can be used to improve your practice as well as for education and research. So it's a rather comprehensive platform that supports all the needs of nursing professionals, be it education, research, or even teaching or even practice. But apart from these learning platforms, we also have a lot of interesting platforms like simulations. So some of you mentioned that there's growing interest in simulation. It's what we have seen in the market as well. There's a lot of growing interest in simulations and visual learning. So one such platform is Clinical Skills. Clinical Skills actually gives you access to more than 2,000 evidence-based skills content that are meant to drive adoption of evidence-based skills in the practice. So it's a great platform for both students as well as practicing nurses to make sure that they are practicing their day-to-day nursing skills in the best, most effective evidence-based manner. So on this platform, you can access videos, and the videos are supplemented by bulleted checklists, bulleted to-do lists that are very easy for the nurses to follow, so that they can make sure that they are providing the attention that the patient needs in an evidence-based manner. Another platform for visual learning is Osmosis. This is a very, very interesting platform because this is meant to make information interesting as well as memorable at the same time. So on this platform, nurses can access a variety of videos that explain basic nursing concepts, but in an interactive video format, which includes images, which includes text, that are easy to remember. So it helps them to create that memory. It helps to create that imprint in your mind when you watch these videos, and you're able to even interact with the content. So that's a very fun visual learning platform. We also have a 3D anatomy platform. The 3D anatomy platform is great for nurses to visualize the human anatomy, and be able to really understand what the patient is feeling. So on this platform, you actually have access to more than 17,000 anatomical structures that the nurses can visualize. It kind of helps you to have a better understanding of where exactly, for example, the patient might be feeling pain. At the same time, you can even show this platform to your patients when you want to have strong conversations with your patients. So you can actually show this 3D anatomy to the patient and explain to them on what's really going on, what's the pathology of their condition, how can they improve their condition, maybe there's some exercises that they can do. So you can actually show all this to the patient when you're using the 3D anatomy platform on your computer or your tablet. So it's a great tool for nurses to improve the quality of conversations that they're having with their patients, also help to improve the patient's understanding of their own condition. So it gives a very good visual view of how the patient is dealing with their condition. So this was a very quick snapshot of some of our platforms. We do have more advanced simulation and visual learning platforms for nursing as well. So if you're interested in any of these platforms or some of our more advanced solutions for nursing like order sets, care plans, or shadow health, we will be flashing a QR code at the end of the session. Feel free to scan the QR code and register your interest, and we will get in touch with you. At this point, if you have any questions about these platforms, or if you have any feedback or interest, feel free to post that in the chat. We'll reply to your chat, and we'd love to hear from you on what you think on some of these platforms, how these can actually help you improve your practice, education, or research. I'll give everybody a minute to post comments in the chat. So while you all think about how these platforms, 3D anatomy, osmosis, clinical skills, ClinicalKey student can be used in your education, research, and teaching, I'm going to focus a little bit on ClinicalKey for nursing. As I mentioned earlier, ClinicalKey for nursing is Elsevier's flagship nursing decision support tool. This is a great platform because it gives nurses access to a wide variety, breadth, and depth of content to help answer questions at the point of care. So when the nurses are in practice, they can use this platform to answer quick questions or research about any medical condition or research about any skills that the patient might require. So you can use this for quick answers at the point of care. And you can also use the same platform for education and research. So in this session, I will focus a little bit on how the platform can be used for all three of these purposes. I won't go into a lot of detail. I'll actually leave it to you to explore the platform at your end, but I would just like to highlight some of the major use cases of this platform. So I'm actually connected to ClinicalKey for nursing through my authorized internet network. That's my authorized IP. Once I'm connected to the authorized IP, I can actually already access all the content on this platform. However, we strongly advise our users to register. So when you register, you need to just put in your first name, last name, your institutional email address. So the institution which has access to ClinicalKey for nursing, if you have an institutional email address, please put that here and create a password of your choice. And then you can just check these boxes and hit register. So we would strongly advise you to do that and set up an account for yourself. In case you don't have an institutional email address, please send us an email and we will support you in creating your own account. So when you register, then log in with the account that you just created. So for me, this is my Elsevier account, my institutional account. I'm going to log in with this. And the reason why we encourage users to log in with the account is because once you log in with your personalized account, you have access to a lot more tools and functionalities. For example, right next to your name in the gray bars on the right, when you click these gray bars, a menu pops up, which gives you access to all these additional functionalities, such as to be able to claim CE as some of you mentioned that continuous learning is very important for nurses. So you can actually use ClinicalKey for nursing to claim CE credits to support your continuous learning. You can also create presentations, and you can apply for remote access. So when you apply for a remote access account, you no longer need to be tied down to the institution's IP network. Once you activate your remote access account, you can actually access the platform from anywhere in the world. So this is also a very useful tool to have. So we would strongly suggest that you activate your login and then activate your remote access. Once you've done that, using the platform is really, really simple and intuitive. So let me just walk you through the homepage over here. In the last 1 year, we've made a lot of changes to the ClinicalKey platforms, and these changes are actually directed to 3 major reasons. So the first major enhancement that we've made is within the domain of increasing speed to answer. Our goal is to make sure that you get your answers as soon as possible. That's why we've actually made our search functionality more intuitive and it covers a lot more terms. So even if you search for more colloquial terms, which are not actually medical terms, you will still be able to find the answers you're looking for. The second major enhancement that you can see on the screen is the division between the point of care content as well as the in-depth content. So ClinicalKey is a great platform because you have access to both point of care content as well as in-depth content on a single platform. You don't need to search on multiple platforms. You don't need to go to different platforms if you were looking for journals versus, say, drug monographs. You have access to both of these content on a single platform. So we've maintained this breadth and depth of content while at the same time trying to improve the speed to answer. The third major enhancement that we've done to ClinicalKey is to make the content more actionable. So we've added new types of content like the calculators. We've improved the quality of the clinical overviews so that they focus more on action rather than passive learning. So the point is that you're able to get the actionable information that you need for practice faster rather than having to go through multiple documents to understand what you need to do. So as I mentioned, on the same homepage, you can access this summarized content, the point of care content, as well as the in-depth content. For example, if you had a particular journal on your mind that you wanted to review, or you wanted to read through a particular journal, just click the journals box on the home page and you'll see a full list of journals that are available on ClinicalKey for nursing. You can actually filter these journals by specialty, or you can jump to a journal of your choice. For example, if I jump to I can actually go into the Journal of International Emergency Nursing. So this is the journal homepage for International Emergency Nursing. When I scroll down, you can see that you actually have access to the journal volumes all the way back to 2008. So you have access to the historical volumes, but at the same time, you also have access to the latest content. So as you can see over here, on ClinicalKey for nursing, you always have access to the most latest content. There are no embargoes on this platform. As soon as the content is made available to us by the journal or the book, we actually post it on ClinicalKey for nursing. So here you can see that even the articles in press are here. You can see that the stage is mentioned. So this is an article press, which is at corrected proof stage. This is at accepted manuscript stage. You can open this article. So when you open the article, you can actually read this entire article in the browser, or on the left-hand side is a table of contents for this particular article. You can jump to the section of your choice. You can go back to the top of the article, and you can even download it in a PDF format. So when you click that little PDF icon, you'll see that the article gets downloaded in the PDF format. At the top, it will mention the stage at which it is, if it's not yet published, and the same watermark will appear to let you know that this is still in a it's not published yet. It's still in the publishing process. So you can read these articles going back to the journal homepage. Let me just go back here. If this was a journal that you would like to read on a regular basis, or based on your specialty or based on your continuous learning needs, there may be some journals that you want to access or read on a regular basis. You can actually just click this bell icon. And when you click the bell icon, the new issue alerts will be delivered to your registered email address. So this is another reason why it's very useful to have your registered account, because then you can set up these alerts and get updated every time there's a new alert for a journal of your choice. At any point, if you want to unsubscribe to the alerts, just click the bell icon again and you will not get these alerts anymore. So that's how you can actually use the home page to jump to a content piece that you are interested in or you're looking at. So if you already know which book or journal you're interested in, you can actually jump to it directly from here. But more often, our research, we've done a lot of research with clinicians and nurses around the world to understand how they come across questions and how they think, what is their thought process when they're trying to answer questions. And we've tried to then map that thought process into our interface over here. So we've done a lot of research, and what we found is that more often than not, there is a question on the nurse's mind, or there is a disease or a condition that the nurse needs more answers on or needs to read something about. So in that case, the most common point of entry is still the search bar. So you'll find that the search bar is up and prominent. ClinicalKey for Nursing has an accompanying mobile app as well. So even on the mobile app, the search bar is the first thing that you would notice. In the search bar, you can just type a query as if you would ask a question. So you don't need to use complicated operators like and or. No, it's a natural language search bar. You can just ask questions, or you can type a question or a search term. So for example, if I search for bed sore, you can see that the system already recognizes what I'm looking for, and it actually starts recommending things that I might be searching for. I'm not going to go into these recommendations. I'm just going to click search. So when I click bed sore, when I click search for bed sore, I get more than 5,000 results. Again, if you're in the clinical environment, sifting through 5,000 results is not an option. You need quick answers. And that's why every time you search for a clinical condition, the first result will always be the clinical overview. This is a very useful piece of document because it gives you all the summarized information that you need to action in the clinic or in the hospital. So in this case, as you can see, I searched for bed sore, but the first result that I get is a clinical overview for pressure injury. Now, within pressure injury, if I was actually looking at trying to confirm the diagnosis, I can actually just click this pink pill and jump straight to diagnosis. So the idea of those little pink, blue, green pills is that you will not even need to read the entire document. You just click the pill. Over time, your mind will remember which color represents diagnosis. You just click it, and immediately you're presented the information on diagnosis. So in diagnosis, you can go through the history, you can go through physical exam, there are images to support your understanding. And as I mentioned, we've made our content more and more actionable. So you'll find that everything in the clinical overview is presented in very short bullets. That makes it very, very easy for the nurse to read, especially when he or she is in a hurry. It also makes it much easier for the nurse to read when they're looking through information on the mobile app. So when you're looking at the mobile app, you don't have to read long paragraphs. You don't have to look for any information. You can just go through these bullets. But at any point, if you wanted to make sure that this information is evidence-based, you can actually just hover, click this the superscript here. The superscript actually gives you the source of this information. So you can always be sure that the bullets that you see here, the actions that you're taking, is always evidence-based. So that's why the clinical overview is a very, very useful tool for nurses at the point of care when they want to understand a new clinical condition, or when they want quick answers, while treating a patient. just go back to the top of the page and you can start reading from the beginning as well. I'm going back to the search results. And as I mentioned, so this is how you can use ClinicalKey immediately for quick answers at the point of care. But our purpose is to allow you to use ClinicalKey for nursing for a variety of use cases. If we focus just on the clinical use cases, some of the other content types that would be useful for you are the drug monographs, the evidence-based nursing monographs, or the clinical calculators. So if you wanted to sift through those, on the left-hand side, you can see a filters menu. So you can actually filter these 5,000 results by the content type, by specialty, or even by date. So for example, in this particular case, if for the purpose of my practice, if I wanted to understand that related to bed sores, what are the latest guidelines? And these, when I say latest, maybe I want to look at guidelines that have been released in the last 6 months. That's how I can filter my results and reach a relevant answer. So for example, if I was looking for rehabilitation after a traumatic injury, I can go through this entire guideline. As you can see on the right, the source for this guideline is NICE, the National Institute for Health and Care Excellence. You can read this entire guideline to make sure that you're practicing evidence-based nursing. If you would like to share this guideline with a quality and patient safety manager in your institution, you can just click on this email icon, insert their email address here. Then your colleague will receive a link to this guideline. When they click on the link, assuming they have access to ClinicalKey for nursing, they will be able to read this entire guideline themselves. So that's a great way of sharing information within the organization. You don't have to download this, print this, or attach it in an email and send it. You can actually just use this email icon here to share the same content. In case you don't want to share it with others, but you want to keep it for your personal reference, just click this star icon and it will get saved to your saved content. So that's an example of the types of content that you can use. Let me clear the filters and show you some of the more useful clinical content types. As I mentioned, you may be interested in the drug monographs. So in this case, we have a drug monograph on benzoyl peroxide. The drug monographs are again all sourced from Gold Standard, which is a recognized, reputed global information database on drugs. Every single drug monograph has exactly the same table of content. It starts with indication and dosage and then goes into administration, interactions, adverse reactions. So for example, as a practicing nurse, if you observed a patient with who had bed sores and you administered benzoyl peroxide, but now you're thinking that maybe they're having some sort of adverse reaction to benzoyl peroxide, you can just jump to adverse reactions and you can see this information right here. Then you can verify if these are some of the reactions and symptoms that you are observing in your patient. So it's very useful to have access to these drug monographs for nurses when they are managing patients in the clinic. Another very useful tool that we've added to ClinicalKey for nursing are the calculators. So on ClinicalKey for nursing, you have access to hundreds of clinical calculators that actually help you to improve the quality of your prognosis and diagnosis. So the clinician may have provided some sort of diagnosis, but you're the one who's observing the patient on a day-to-day basis. You can monitor their improvement using these calculators. So for example, I've opened the calculator for stage 4 pressure ulcer. You can actually use this calculator here. You can just like see whether necrosis is present, non-necrotic tunneling. Let me check necrosis present and then debridement protocol, or I can reset it. Similarly, as you can see on the left, there are hundreds of other calculators available. If you go into body metrics, for example, there's the BMI calculator. Here you can actually input data. So maybe in this case, the patient's height is, let me put this in centimeters. Maybe the patient's height is 150 centimeters and the weight in kgs is 75. And we get a BMI of 33.3. So rather than you having to calculate this BMI, you can actually use this calculator to get the BMI here and then record this information in the patient's record for future reference. So again, these calculators are very useful for nurses when they're managing patients. Another useful content type that I want to highlight are the evidence-based nursing monographs. So these nursing monographs are great for understanding the actions that nurses need to take. So these nursing monographs always start with a clinical question. They highlight the problem and then they go into the current practice and clinical practice guidelines. So I'm going to jump into current practice and you can go through this. Again, the literature to support this practice is also stated over here. So you can be sure that you're practicing in an evidence-based manner. There are also links to other labs and scales, like you can actually jump to the Braden scale from here itself. And if you scroll down further, there's also synopsis of the current literature. So this actually shows you the level of evidence as well. So that's how you can be very, very sure that the practices that you're adopting in the clinical environment are entirely evidence-based with the support of the level of evidence over here. So these are again great tools for a clinician or for an institution to ensure that the nursing practice is evidence-based and in line with global standards. But if we move away from practice, maybe a lot of the nurses who are joining our session today are interested in education and research. So if you're interested in research, for example, you may want to look at journal articles. So for bedsores, as you can see, there are more than 2,500 journal articles. And again, you can filter these journal articles by the type. So maybe if you just wanted to, within journal articles, if you wanted to look at the random control trials, you can select random control trials and you can go through these journal articles over here. Again, you can open an article of your choice. You can read this article in full text, jump to a section of your choice, or even download a PDF copy of the same article. So that's how ClinicalKey for Nursing is very, very useful in research because of the different types of content, especially the journal articles that can support your research. On the other hand, if you wanted to use ClinicalKey for Nursing for education, you might be interested in the books. So you can filter the content by books and open a book of your choice. When you open the book, you can, as you can see, it jumps to the section that I clicked on. So you can start reading from here. You can go to the top of the book chapter. You can even click on the book to identify other chapters that you may want to read. So this is very much like a digital textbook that you can access on ClinicalKey for Nursing. You can even share these links with your students, with your colleagues, so that they can also read the chapters or the topics within these books. Apart from books, there are a lot of other types of tools and content that are useful for education. So for example, if this was education not just for nursing students, but also for nurses in practice, you may be interested in looking at some of the procedure videos or the other videos. So there are other 57 learning videos. There are 9 procedure videos. Let me show you a procedure video here. So when I click on a video, at the bottom of the video, there's all the pre-procedure, during procedure, after procedure information, including the equipment that is required. There are images to support understanding further. But if you wanted to watch the actual video, just scroll back to the top and you can start watching here.
The coaptation splint is used to immobilize the humerus. Most frequently, the splint is used for fractures of the humeral diaphysis, such as the oblique midshaft humerus fracture.
So there are many such videos available for nurses to use for teaching for students as well as for nurses in practice. Going back to the results, as I also mentioned, let me just clear this filter and highlight the images. So another very useful tool for teaching purposes are the images. On ClinicalKey for Nursing, you have access to thousands of images that can help you improve the quality of your presentation as well as the understanding in your lectures for your students. So when I click on images, as you can see, the images get listed over here. I can actually click on an image and view the image in full screen. Under the image, you will find that there is a description of the image and the option to view the source of the image. But in addition to these description, there are some additional icons here. So I mentioned the email and the save icon, but there's a new one over here, which is the rectangle with the triangle. That's a new icon, which you will find only next to images. This is the add to presentation icon. So I can actually click this. And I can add this image to a presentation. So I can start by creating a new presentation, or I may want to work on a presentation that I was already working on. So for example, I was working on bed sores earlier. I'm going to choose this presentation and I'm going to add this image and then close this. I can even select multiple images. So for example, if I wanted to add this image and this one, as well as this one. So you see, as I'm adding images, the same menu pops up on top. It shows me that I've selected 3 images, and now I can click on the presentation icon and select my presentation and add these. So I can continue adding more images, or at any point, if I want to go back to see my presentation, on the top right corner, again, click on the gray bars here and click presentations. So as you can see, these are all the presentations I've been working on in the past. My most recent one was AFib, but I've also been working on the bed sores presentation. There are so many images here that I've added. I can actually download these. So when I click export, oops, sorry, there's some error here. Let me just start. Let me just choose another one. So this is again the bed sores nursing. Let me just export this. Sometimes when my internet is slow, it gets the present, and especially when there are like so many images, it becomes a little hard to download. So you just have to come back, and here you go. So the images which I had selected earlier, as you can see over here, they get downloaded on a PowerPoint slide. But more importantly, it's not only the image. Along with the image, you also get the source and citation. So this is very useful for education and research because you can use these images. These are copyright cleared, high definition images, so you can even use them in research papers. But along with the image, you also need to have the source and citation. You can actually copy the source and citation from here itself. You don't have to create your own citation. So this really helps you to save time as well as ensure that you're using high quality images for your teaching or even for your research or even for your MOM meetings, for example. Going back to the platform, one last point that I want to show you here is that we've seen the presentation maker on the right-hand menu. We've seen the presentations tool. I also want to show you the CE tool. So this is again a new content type that we've added to ClinicalKey for Nursing, and it's a great resource for continuous learning and for practicing nurses. So you can actually go into the CE tool. You can choose a topic, or you can assign, if you're a nurse manager, you can assign a topic to your nurses. So maybe you want to look at the topic on caring for pierced clients. And you can go through this topic in detail and then earn contact hours over here. So you can actually go through this topic, you will earn contact hours, you will earn some pharmacology credit. You can even click on how to earn credit to learn more, or you can directly go to the test. I won't go into the test because I'm not a qualified nurse. I'm not attached to any nursing institution. So I'm not going to click it. But for those of you who are practicing nurses, just click on go to test, answer the test, and you will be able to earn the credits for the CE credits for this particular topic. So there, as you can see, there are many topics available on CE. You can actually go through these, or you can assign a relevant topic to your nursing teams. So that was a quick overview of ClinicalKey for nursing. As I mentioned, I won't go through everything on this platform because there's just so much and we have so little time together today. So I would encourage you to go through this platform yourself, browse through it. It's very simple. It's just simply clinicalkey.com/nursing. Feel free to browse through the platform. And then if you have any comments or feedback, you can always write back to us. If you would like to arrange a trial for the platform, as I mentioned, at the end of the session, we will be flashing a QR code. Just scan the QR code and register. We'll come back to you with a trial. For those of you who already have ClinicalKey for nursing, if you would like to organize a customized session for your institution, we would be happy to do so. Again, just scan the QR code and leave your comments, and we will get in touch with you. So that brings us to the end of my presentation. Can I check if there are any questions or feedback or comments from the audience? I'll give you all a minute to absorb all of this, and I'll wait for you to post your questions or comments in the Q&A box or the chat box. Feel free to also comment anything else apart from ClinicalKey for nursing that you would like to have more information on. I noticed somebody raised their hand. If you have a question, please can you post it in the chat box or the Q&A box? So there's a question on whether there are topics on COVID patients. Actually, yes. All our solutions carry information related to COVID. Let me show you as a sample. Let me show you the information on COVID in ClinicalKey for nursing. You can actually search for COVID over here, which I'll do in a minute, or you can scroll down and you can even access the Elsevier COVID-19 toolkit. So this Elsevier COVID-19 toolkit is a free resource that's easily available to not just our subscribers, but anybody who would like to have access to this. You can just go to this resource on this COVID-19 toolkit. Let me shut this. You'll find that there are different types of subtopics that you can research. So for example, if you wanted to look at the COVID-19 guidelines, just jump to that section and you can go through all this information on COVID here. So I would encourage you to explore this resource. It's a free resource. It has a lot of information on skills, guidelines, drugs, long COVID, management of patients. It has all of that information. Coming back to ClinicalKey for nursing, you can, going back to the search bar, if you just search for COVID, it again recommends things that others have been searching for. You can go to the recommendations or just click search. So a search for COVID actually results more than 16,000 results. You can continue to use the filters on the left to focus your search a little bit. Or if you look here, there is actually a specialty called 2020 COVID-19. So this gives you actually all the data which from the peak period of COVID. So if you really wanted a lot of information on 2020 COVID-19, you can actually filter for this particular specialty. Or as I mentioned, if you're observing a COVID patient in your practice, just look for the clinical overview and you'll get all the summarized information of on COVID-19. As you can see, this was last updated on 26th May, just a few weeks ago. And you can go through it over here in a summarized bulleted format. So indeed, there is a lot of information on COVID that is available on ClinicalKey for Nursing, and a lot of information available on this free resource, which is the Elsevier COVID-19 Healthcare Hub. I'll copy this link and post it in the chat for everybody to access.
Natasha, I think I'm looking at your ClinicalKey for Nursing page only.
Oh, sorry.
Yeah, it is. Yep.
Thanks, Jade. So sorry, let me just go over this again. So this is the Elsevier COVID-19 Healthcare Hub. As I was saying, on Elsevier COVID-19 Healthcare Hub, there are many subtopics that you can refer to. You can refer to vaccines, inpatient care, ambulatory care, all of those things. So you can refer to these subtopics, and all of this information, it includes a lot of information on skills, on drugs, on practice guidelines. So you can go through this. Or if I go back to ClinicalKey for Nursing, a search on COVID actually gives you more than 16,000 results. So you can narrow these results the way I mentioned earlier. Or if you look at the filters over here, there's actually a specialty called 2020 COVID-19. So this gives you all the information on COVID that was published at the peak of that COVID period. So there's a specialty just for COVID-19 that you can look at. So you can filter the results for just this specialty. Or as I mentioned, if you want quick answers to support the treatment or management of a COVID patient, just go to the clinical overview. And you can look at all the information that you would require for the treatment or management of a COVID patient in bulleted format here. So in a nutshell, to summarize again, there's a lot of information on COVID-19 on ClinicalKey for Nursing. Even on our other products like Clinical Skills or Complete Anatomy, we do have dedicated information or skills information on COVID-19. And we also have this resource, the COVID-19 Healthcare Hub, where you can access some of this information for free. I've posted the link on the chat. I'm very sorry about the slip earlier. Any other questions or comments from the audience? Okay, if there are no further questions, we can then pause this webinar for now. Before we conclude, I want to express my sincere thanks for joining this session. We really appreciate your time and your feedback. Do share your feedback on this QR code over here. Also, we would be very happy for you to visit this page that we've created. So as you can imagine, last week was Nurses Week, and that's a big occasion for Elsevier. Actually, let me show you this page since we have some time. So the Nurses Week is a big occasion for Elsevier, and we celebrate Nurses Week by supporting you by providing more content and guidance. So this is this year's Elsevier Nurses Week page. You can actually browse through this page. It has more resources. It has some contests, but I think the contest is already over because it was last week. But it has some wellness resources as well. So you can go through this page and access more resources which are available for free in commemoration of the Nurses Week. So that would be my final remark for today. Once again, thank you so much for your time and attention. Thank you also very much for your questions and comments. Feel free to give us feedback by using the QR code or the link.